think there's two main reasons why it's important. Firstly, you need to have the right medications in the house for what you need. And if you've got too many medications, it can be quite easy to get confused and not take the right ones. The other really important reason is that we know each year about £4.5 million is wasted on unused medication in Northamptonshire. And at a time when the NHS is struggling for money, we need to make sure that all of us use things as effectively as possible. Knowing what you're taking, what are your regular medications, and what are the medications that you use just some of the time. In the past, people have ordered all their medication every month, whether they've needed them or not. And I remember a couple of years ago going to see somebody who had a whole drawer full of unused medication. So if people take that personal responsibility with their pharmacist, that's going to be the best way to avoid that waste. Your practice would always be able to prescribe that medication for you. Practices in Northamptonshire now are letting you order online, so talk to your practice about how you can sign up for online services. If not, they'll have another way of ordering the medication that you've had previously. I think by doing campaigns like this, we're working with the pharmacists, we're working with patients. Our main change has been that we're asking patients to order their medication themselves rather than bulk order them through pharmacists, which has happened in the past. The best thing to do with unused and out-of-date medicines is to take them back to your pharmacist. Don't put them in your general rubbish, don't flush them down the toilet, but take them back to the pharmacist. Over the winter we all get far more coughs, colds, tummy upsets, and we can make life much more comfortable and convenient for ourselves if we've got the right medications in stock. Now, if you go and talk to your local community pharmacist, they'll be able to give you advice what's best for a general medicine cabinet and what's particularly useful for you, taking into account any problems that you might have and making sure that those tablets are right for your regular medication as well. Nationally, the NHS has had to look at ways that we can use all the money that we've got as effectively as possible. One of the things that we've realised is that a lot of money in medicines is being spent on day-to-day over-the-counter medication. So we've taken a decision, along with other organisations across the country, to ask people to buy those medications themselves so that the scarce resources can be used on the more expensive medications that can only be prescribed by a doctor.
Okay.